everyone, today we will discuss Viva questions on fibula. So, skeleton of leg, there are two bones, tibia and fibula. Tibia, it is medially placed bone, and the fibula, it is a laterally placed bone. Now, when we compare the size of the tibia and fibula it is very thin and slender, and tibia it is massive bone because at the upper end it takes part in the formation of the knee joint, and that's why it transmits much of the body weight, and that's why it is bulky in size in comparison to the fibula. At the lower end, fibula along with the tibia takes part in the formation of the ankle joint. Now side determination of fibula. So fibula, it is a long bone, so it has upper end, it has intervening shaft and it has lower end. So to determine the side of the fibula, सबसे पहले आपको identify क्या करना है, lower end. अब lower end के characteristic features क्या है? At the lower end we have the two structures present. One is the facet, right? So one is the facet and another thing it is the fossa. This fossa it is also known as the malleolar fossa. तो अगर malleolar fossa को आपने identify कर लिया तो you can easily determine the side of the fibula. This fossa, this is the medial surface of lower end. One thing that you have to remember, this is the medial surface of the lower end of the fibula. So facet it is placed anteriorly and this fossa it is placed posteriorly. So जब भी आप साइड डिटरमाइन कर रहे हो फिबुला का, सो एट दैट टाइम आपको क्या करना है, मेल्युलर फोसा के अंदर अपना थंब रखना है, राइट, और उसे ऐसे पकड़ना है. दिस इज़ द मीडियल सरफेस, फर्स्ट थिंग. एंड सेकंड थिंग, यू हैव टू कीप दिस पोस्टीरियरली एंड फैसेट. सो मेल्युलर फोसा आपकी तरफ रहेगा एंड दिस आर्टिकुलर फैसेट जो है टेलस के लिए वो कहाँ पे रहेगा, एंटीरियरली. So this will help you to identify the side of the fibula. Now what are the characteristic of upper end of fibula? So at the upper end of fibula we have a facet is present, and this oval facet it is for the articulation with the lateral condyle of tibia, and it forms the superior tibiofibular joint, which is a plain variety of synovial joint. Then this posterolateral to this facet there is a process, and this process it is known as the styloid process. So this styloid process it gives attachment to the fibular collateral ligament, and just in front of it there is a sloping surface, and this sloping surface it provides insertion, C-shaped insertion of the biceps femoris muscle. Which structure directly comes in contact with the neck of the fibula? So a constricted portion just below the head it is known as the neck of fibula, and at the posterolateral side of the neck of fibula there is a common peroneal nerve which directly comes in contact with it. So whenever there is a fracture of the neck of the fibula, or there is a tight plaster around the neck of the fibula, then it may compress the common peroneal nerve. So whenever there is a damage to the common peroneal nerve, it leads the foot drop. Enumerate ligaments present around the lower end of fibula. So here lower end of fibula it articulates with the lower end of tibia, then it articulates with the talus bone. So here between the tibia and fibula, at the posterior side there is a posterior tibiofibular ligament. Then between the talus and the fibula there is a posterior talofibular ligament. The same way at the anterior aspect there is anterior inferior tibiofibular ligament. This is fibula and this one is the tibia. So this is anterior tibiofibular ligament, and between the talus and fibula also there is anterior talofibular ligament. So total 4 ligaments are formed between the tibia and fibula and talus and fibula. So anterior and posterior talofibular ligament and anterior and posterior tibiofibular ligament. As well, from the tip of the lateral malleolus to the calcaneum there is a ligament, and this ligament it is the calcaneofibular ligament. Which ligaments are present in the malleolar fossa? So in the malleolar fossa there is a posterior, at the lower part there is a posterior talofibular ligament, and in the upper part there is an inferior transverse tibiofibular ligament. Which bone violates the law of ossification? So fibula is the bone which violates the law of ossification. Now how? So as per the law of ossification, the pressure epiphysis, the ossification center for the pressure epiphysis appears earlier than the traction epiphysis. Now in fibula, upper end it is the example of traction epiphysis, and the lower end it is the example of pressure epiphysis. So as per this law, the center of ossification appears at the lower end earlier than the upper end. Now, as per the other law of ossification, the ossification center which appears first, it has to fuse last. But here in fibula, this center appears first as well as it fuses first. As this upper end, it is the grooving end of the fibula. Thus, it violates the law of ossification. Name the joints formed between the tibia and fibula. So with the tibia and fibula, there are three types of joints which are formed between these two: superior tibiofibular joint, then middle tibiofibular joint, and inferior tibiofibular joint. Superior tibiofibular joint, it is a plain variety of synovial joint. Middle one, it is the fibrous joint, and inferior tibiofibular joint, it is a syndesmosis kind of joint. And at the lower end, this lateral malleolus, it articulates with the talus and takes part in the formation of the ankle joint, which is modified hinge variety of joint. Attachment on the lateral surface of the shaft of fibula. So lateral surface of shaft of fibula, it gives attachment to the two muscles, peroneus longus and the peroneus brevis. So we can divide the lateral surface into the three part: upper one third, middle one third, and the lower one third. So upper one third, whole upper one third plus posterior surface of middle one third part, it gives origin to the peroneus longus, and the lower one third and the anterior surface of the middle one third portion, it gives origin to the peroneus brevis muscle. Attachments on the medial surface of the fibula. So medial surface of fibula, it is located between the anterior border and the medial border. We can divide this medial surface into the four parts: upper 1/4, middle 2/4, and the lower 1/4. So entire lower 2/4 portion, it gives origin to the peroneus tertius muscle. Then upper 1/4 along with the anterior half of the middle 2/4, it gives origin to the extensor digitorum longus, and the medial posterior half of the 2/4, it gives origin to the extensor hallucis longus. We can remember it as the hospitals are never dirty places, right? So here the tibialis anterior muscle. So this one is the tibia. So lateral surface of tibia, it gives origin to the tibialis anterior muscle. Then we have the hallucis. This is the artery and nerve. So hallucis digitorum and the peroneus tertius. So this is the extensor compartment. Anterior compartment is, so this extensor hallucis longus, extensor digitorum longus, and the peroneus tertius. These three muscles, their attachments, they are on the medial surface of the fibula. Now attachment on the posterior surface of the fibula. Suppose this is the posterior surface which lies between the medial crest and the posterior border. So upper 1/4 portion, the soleus muscle, it originates from the upper 1/4 portion, and the flexor hallucis longus, that is from the lower 3/4. This is the nutrient artery of fibula. So peroneal artery, it gives of the nutrient artery for the fibula. Now apply related to the fibula. So fibula, it is a thin and slender bone. We can use it for the purpose of bone grafting. And another important applied related to the fibula, it is the Pott's fracture. In Pott's fracture, there is a fracture of the lower end of fibula, that is the fracture of the lateral malleolus followed by fracture of the medial malleolus and tearing of the lower margin of the tibia. So this is the first degree of fracture, this is second degree, and this is the third degree of Pott's fracture. This happens when food got caught in a hole in the ground, and it leads the forceful external rotation and the abduction of the foot.